According to the Centers for Disease Control, more than 500,000 people have died in the U.S. from opioid overdose in the last 2 decades. Data collected in 2022 suggests that in California, there were 7,000 deaths from opioid overdoses. Nearly 9 out of 10 of those opioid-related deaths involved an overdose from fentanyl. And more prescription pills were responsible for more than 21,000 emergency room visits. As state leaders continue to fight against the epidemic, they want you to be part of the conversation. Tomorrow, the California Association of Nurse Anesthesiology is holding a symposium to discuss those solutions. Joining us this morning to talk a little bit more about it is Emily Frank, the president of the California Association of Nurse Anesthesiology. Thank you so much for joining us.
Thank you for having me.
I know we kind of broke down some of the data right there, but give us a little bit more of an overview, if you can, of just this epidemic that we're seeing across the country and here in Northern California.
Absolutely. So what we've been seeing is a trend towards, or at least evidence that shows that there are patients' first exposure to opioids tend to be in the operating room or even in the area in and around the operative care services. And so if we have a role to play in that, which we do as nurse anesthesiologists, we also feel a responsibility to address the problem at where it starts. So we've developed numerous techniques to address this problem in the OR by not using narcotics or opioids, using other types of techniques like regional pain anesthesia techniques, and it's been a very long process, but we're fighting it from the start.
Yeah, and you know, it's great that you folks are starting it from, you know, that part of the timeline, because there are a lot of misconceptions about who this impacts and how it all gets started. What are some of those misconceptions out there?
Well, I think the first and foremost, the scariest is how young it's starting. So Stanford University actually put out a study a few years ago that showed that patients, adolescents, children that are having their wisdom teeth removed, for example, are being exposed for the very first time at that age, and up to like 6%, 7% of those are going on to have substance use disorders after their care. And that's something that we need to be honest about, and we need to address, and that's one of the things we want to do tomorrow.
Yeah, and you know, as far as the public is concerned, why is it important for you to have them there and to maybe even get some of their input?
The public is the #1 stakeholder. They're the ones that are being affected by this. I think just about everyone knows somebody that's been affected personally in their community or in their own families, let's say, that really needs to look at the realities of what's causing this and ways that we can work together as a community, as California government and individual community leaders can work towards resolving this epidemic.
Sure. As far as registering, people can do so in person. I know they can also do online. Where is everything being held tomorrow? It's
actually at the Secretary of State's office here in Sacramento, but we also have a live Zoom that will be going out throughout the state, even throughout the nation if they'd like. So we encourage people to attend in person, but of course if they are not here locally, they can do so over Zoom.
All right, Emily, thank you so much for joining us this morning. A very important discussion. Hopefully some folks turn out so you can also get their perspective as well.
Yeah. Well, thank you for having me during National CRNA Week.
Absolutely.
Thank
you again.
Thank you.